keeping the heartbeat of the city healthy with health tips and benefits from real doctors in the area. This is Health Help.
Hi, I'm Dr. Stephen May, and I'm the Regional Medical Director for Sullivan County Regional Health Department. Today we've been asked to talk about cold and flu and what it means to you and the preparations for the season that's coming up. Typically we see our cold and flu season begin in late October and extending into late February and into March. So we are entering the peak seasons. Now there are a number of viruses that co-circulate at the same time of flu, and they're the ones that causes your coughs, colds, congestions, little flu-like syndromes. And at the health department we monitor the level of these diseases and the type of viruses that are circulating. One of the more serious viruses that we are concerned about is with the influenza or flu virus that circulates every year. We typically see a peak of it, and it can be as early as October through February or March. Typical peak seasons typically are January or February type time seasons. But this is the time of year we like to prepare people for flu by getting their flu vaccines. This year the flu vaccine has come out, and we are in full swing of seeing that particularly our high-risk populations are immunized. That includes the elderly, those with chronic debilitating diseases such as diabetes, congestive heart failure, those who are immunocompromised, to receive their flu vaccine. We also have a massive push to ensure that our pregnant women are vaccinated because they have a much higher risk of complications and death from the flu virus. Another targeted group is our young children, and young children tend to be our super spreaders. They like to spread this virus very efficiently, and particularly they spread it first to our adults, and then our adults take it to our grandparents and grandchildren. So we have a motto in the health department: protect the ones that you love, get your flu shot. Flu may not kill you if you're young and healthy, but certainly if you're elderly, debilitated, or very young or pregnant, it can be a very deadly illness. This is also the time and season that we talk about other preventive measures. We talk about keeping our hands washed multiple times and make an effort not to touch your face, particularly around your eyes, as this is where the virus goes directly from the tear ducts directly into the very tip top of your nose, where it's so sensitive to these cold and flu viruses. So we ask you not to rub your eyes or touch your eyes unless you've washed your hands. Also, if you're ill, we request that you stay home, that you not transmit these viruses to the loved ones and your co-workers that could potentially become ill. We see lots of spread of disease, particularly in the cold weather seasons, because we're all cooped up, closed up. We have dry humidity with the heat coming on. And so as such, that's why we see such an increase in the incidence of these type of diseases during this season. So once again, prevention is key. Cover your coughs, don't touch your face, get your flu vaccine, and protect the ones that you love.